Thank you and good afternoon, Mr. Speaker, sir, Honorable Prime Minister, Honorable Deputy Prime Ministers, Honorable Cabinet Ministers and Assistant Ministers, Honorable Leader of the Opposition, Honorable Members of Parliament, distinguished guests, ladies and gentlemen, members of the public joining us virtually on the various platforms. Ms. Ambula Binaka, and good afternoon to you all. Honorable Speaker, sir, I rise to respond and support His Excellency the President Ratu Nengama Lalombalawu's most gracious speech during his address in the opening of the 2025-26 session of Parliament on Monday, the 24th of February, 2025. On the outset, I would like to also put on record my congratulations and sincere thanks to His Excellency the President of the Republic of Fiji for his decisive leadership in the People's House, in this House. During those turbulent times, when an abrupt decision was taken by party leaders, it was His Excellency's affirmative response according to law and his wisdom that allowed me and my other 16 former members of the now deregistered Fiji First to continue to pursue our political career, our aspiration, and nation building into this term of Parliament. Honorable Speaker, I wish to begin by thanking the Honorable Prime Minister, Honorable Sitiveni Lingamamanda Rambuka, for his faith and confidence in me in bestowing the position of Assistant Minister for Health and Medical Services. Honorable Prime Minister, sir, I vow to carry out my duty to the best of my ability and repay your faith in me by assisting and supporting my line minister, the Honorable Ratu Antonio Lalambalawu, as he steers the ministry ship towards the ministry's vision of having a healthier population in Fiji. To the Honorable Health Minister, sir, I thank you for the assistance and advice rendered to me in just a few weeks in the office. Honorable Speaker, sir, the 44th President of the United States of America, His Excellency Barack Obama, in his maiden speech some 16 years ago stated, and I quote, "Today I say to you that the challenges we face are real. They are serious, and they are many. These challenges will not be met easily or in a short span of time. But now, this America, this will be met," unquote. Similarly, Honorable Speaker, I wish to reiterate the same message to all Fijians today. Continue to have faith in your government and in the ministry and its service. With our far too long ignored health infrastructure, not the best equipment to work with in our health setting, and the poor planning over the years has no doubt given us enormous pain, lost opportunities, and greater challenges. My plea to all Fijians with limited resources, give us time and we will surely get there together. Mr. Speaker, sir, I also would like to acknowledge the support of the entire Apostle Fellowship International Church, the church that I lead, for your prayers and for your support. Also to my family, I thank my family for the support that they rendered to me in this time. Mr. Speaker, I rise today with deep gratitude and profound sense of duty to respond to the inspiring and visionary speech delivered by His Excellency, the President of the Republic of Fiji, who is a distinguished leader of the Tobata Confederacy, Turanga Natuidakau. His Excellency's words serve as a guiding light for our nation, calling for unity, shared responsibility, and collective progress for our beloved Fiji. His Excellency has reminded us that the change we seek must begin in this very parliament. As elected leaders, we carry the trust of our people, and it is our duty to work together, rising with the tide as one nation. The vision of rebuilding Fiji together is not just a call to action, it is an obligation that requires us to move forward in unity, embracing our diversity and our greatest strength. In strengthening our health sector for a united Fiji, Honorable Speaker, as an Assistant Minister for Health and Medical Services, I reaffirm my unwavering commitment to ensuring that the health and well-being of every Fijian remain my top priority. His Excellency has underscored the importance of strengthening our healthcare system, ensuring equitable access to quality medical care services, and fostering resilience in the face of emerging public health challenges. In alignment with this vision, the Ministry of Health and the Medical Services will continue its effort to improve primary health care services, ensuring accessibility in urban, rural, and our maritime community. Health is not merely a government responsibility. It is a shared commitment that involves communities, faith-based organizations, civil society, the whole of government, and private sector. We will continue fostering collaborative effort to promote preventive health care, wellness, and a healthier Fiji. In his speech, His Excellency spoke about government plan to improve the ministry infrastructure and modernize our healthcare facility around the country. Mr. Speaker, Ministry is committed in improving the long-neglected health infrastructure, ensuring better planning and prioritization to be in line with the increasing population and our evolving healthcare demands. Ministry of Health and Medical Services is committed to carrying out its planned infrastructure improvement activity to upgrade and improve its over 200 health facilities around the country. I am pleased to inform this August House that we have already commenced critical renovation and infrastructure upgrade across the country. Now, for that side of the House to spill out that the Minister of Health is not doing anything is not true, Mr. Speaker. In fact, we are now fixing up the shambles that were left behind by previous government. In November last year, our maintenance team have completed renovation work that include the roofing, plumbing, and tiling, and painting work at Ondo Nursing Station, Fulanga, Ongea, Listen, Namukai Lau, Mode, Common Nursing Station in the Southern Lau Group. Later this month, the maintenance team will undertake...
Order. I urge honorable members to give the opportunity to the Speaker to speak and explain in his address what he is in support of and his response to His Excellencies. Give him the opportunity. You may continue, honorable member.
Thank you, Mr. Speaker, sir. In November last year, our maintenance team have completed renovation work, including painting at those nursing station and health facility. And later this month, the maintenance team will undertake renovation work at Soso, at Badalea nursing stations in Kandabu. This will then be followed by planned renovation work for Oneilau Health Center, Watoa Nursing Station, Totoya Nursing Station, Moala Health Center, and Nasoki Nursing Station on Moala Island, the Matuku Health Center and Lebukendaku Nursing Station on Matuku Island in Laos. Renovations are planned by April this year for Nayau Nursing Station, Vanuatu Nursing Station, Lomoloma Hospital, Molebu Nursing Station on Vanombalabu Islands. On the Western Division Health Infrastructure Development, Mr. Speaker, renovation has commenced at Rewanga Nursing Station in the province of Nabosa, Bukuya Health Center, Momi Nursing Station, Tabo Hospital, Nandi Hospital, fencing project at Nangatangata and Nandarivatu health facilities, sewer line upgrade for Mbalivuto, Nailanga, Ba, and the quarters for the SDMO in Ba. Similarly, the ministry has planned renovation work and fencing of V1 nursing station, Somosomo nursing station in the Yasawa group. For the Northern Division, maintenance work is also scheduled for Lekutu Health Center at Nakandrundu, Korbatu Health Center in the Tikin of Woilebu, Koro Health Center, Pisongo Nursing Station in the Tikin of Namuka, Pulibutu Nursing Station in the Tikin of Nandongo, and Kumbulau Nursing Station in Bua in the Northern Division for this calendar year, Mr. Speaker, sir. For the Central Division, infrastructure development for Namara Nursing Station, Mokani Health Center, Lomaibuna Nursing Quarters, the Nafil Health Center, Tamavua, the Bunindawa Subdivisional Hospital, Dao Samu Clinic Extension as well. In addition, Mr. Speaker, sir, the Ministry of Health has completed the purchase and installation and commissioning of new backup generators for various health facilities. Waimbokasi Hospital, Nosori Health Center, Bolebu Nursing Station, Namara Nursing Station, Lami, Samambula, Rewanga, Nafil Health Center, and also the divisional office up in Tamabua, the Central Division Head Office. Budget allocation for this is $1.5 million. This has been fully utilized, and this project are ready in the Central Division. Honorable Speaker, sir, the ministry is also working closely with our development partners for their support and assistance toward infrastructure development. New Zealand Ministry of Foreign Affairs and Trade, or MFED, have undertaken and completed a number of refurbishment and upgrade work in the Central Division, such as the one in Ngaloa Nursing Station, Makoy Health Center, Nosori Health Center, Waimbokasi Hospital, and the newly built Ndongo Nursing Station in Tailebu. MFED also refurbished Momi Nursing Station and also built a new quarters for the staff nurse at Momi Nursing Station, which will be open shortly. COICA funded and the WHO implemented SHAPE project on the renovation of health facility in the Central and Western Division. This project will cover necessary maintenance and repair at Naililili Nursing Station in Rewa, Nasongo Nursing Station in the interior of Naitasiri, Nabunikambi Nursing Station in the province of Namosi, Nayabu Health Center, Wenimbuka, and Verata Nursing Station in Tailebu. In addition, Mr. Speaker, the SHAPE project will undertake solarization project for health clinic and staff quarters in 17 health stations around the country, which include Tukabesi Health Center, Buna Nursing Station, number 1 Nursing Station in the Northern Division, Tubuda Nursing Station, Talaulia Nursing Station, and Lakamba Hospital in the Eastern Division, and Kese Health Center and Vatulele Health Center in the Western Division. The ministry is also working with UNICEF and the Ministry of Public Work for additional solarization project targeted health facilities going towards renewable energy, Mr. Speaker said. The ministry is not only focused on maintenance work for smaller health center, they are also working to upgrade subdivisional and divisional hospital that is under the public health sector. Ministry is working with the public works in large project, refurbishment and electrical upgrade for Lambasa Hospital, Nabo Hospital, Tabo Hospital, and Rakiraki Hospital, which have been budgeted for this financial year. Also happy to inform that that 4 new elevators for CWM have arrived in the country, and the overseas-based installation engineer are expected into the country shortly to undertake the installation and commissioning work in the next few months. Also, the new 128-slide CT scan machine donated by JICA has arrived and has been installed at CWM Hospital. The machine is awaiting commissioning in a not too distant future. Another similar size CT scan has been purchased by the ministry and is now positioned at Lambas Hospital. Once the electrical upgrade work for Lambas Hospital has been completed, that machine, the CT scan for the Northern Division, will also be commissioned then. Honorable Speaker, work on the construction and installation of medical incinerator is ongoing at the landfill in Namboro. Medical incinerator was funded by the World Bank as part of the COVID-19 pandemic response support and will serve the health facility in the Central Division. As alluded to by the Honorable Minister for Health, yesterday the Fiji 14.5 million DFED funding CWM redevelopment project is progressing well with a number of critical phases of the project already completed. Honorable Prime Minister has launched the project for the PIP on the 31st of January this year, and the Australian government has committed an additional $14.5 million for the essential upgrade work of the hospital while the master planning work for the new hospital continue. PIP report will now guide the need and the much needed work that will be undertaken at the CWM hospital in coming months while services at the hospital will continue. Now, with the fleet and medical boats and vehicles, Honorable Speaker, the ministry is also committed in upgrading and improving the fleet of vehicles and boats that are used for transportation of staff and patients at our various health facilities. In the last 12 months, the ministry has provided new medical boat and engine for Kavala Health Center, Ngau Health Center, and Lakemba Hospital in the Eastern Division. Bisongo Nursing Station, Tikena of Namuka, and Tawaki Nursing Station, towards the Undu Point of Unobatu, the Naililili Nursing Station in Rewa, and Rabi Rabi Nursing Station in the Central Division. The ministry plans to continue its effort, upgrade its medical boat fleet, and also its ambulance services. The minister would like to record his sincere appreciation to the Ministry of Finance and Strategic Planning and National Development for the support in contracting private ambulance to complement the work of the hospital-based ambulance. Mr. Speaker, the ministry is also looking forward to the commissioning of 6 new ambulances donated by the government of Japan to be distributed soon to our hospital and health centers. Digital health, modernizing our health services, also require the ministry to engage into the use of more digital and virtual space to improve our healthcare service delivery. Ministry is implementing its digital health strategy 2023 to 2027 and continue to work with our partners to improve integration and interoperability amongst the many information systems in use at the ministry. At the moment, 18% of our healthcare facilities have low bandwidth connection and 9% are yet to be connected to internet connectivity due to geographical location. Ministry will pursue a similar partnership to improve access to digital health in our rural and maritime health facilities, Mr. Speaker. In improving essential medicine, His Excellency the President in his address also pointed out ongoing effort to improve procurement of medicine that will result in better access essential medicine for our patients. The Fiji Pharmaceutical and Biological Services, FPBS, have completed the rollout of the M Supply Inventory Management System for medicine and medical products across our health facility. For the last 12 months, the experience gained and the learning that are useful to improve the system, so far the average processing time for request of supplies from FPBS have been reduced from about 1 week to now only 1.5 days to complete the process. The ministry has also started facilitating procurement processed through using the M-supply system. Our initial attempt to show significant reduction in processing time for procurement of supplies from our overseas source, the ministry will continue to progress this further. Ministry, in June 2024, Mr. Speaker, the warehouse, the second warehouse that was funded by the World Bank of approximately 1.9 million was opened at Watuanga, and it has now housed the biomedical equipment and consumable for the Central Division. Later this month, the warehouse Tolu, which is funded by JICA, will be opened in Lambasa in the Northern Division. This will ensure that medicine and medical supplies required by health facilities in the Northern Division are supplies from a nearby warehouse, rather than waiting for supplies to come from the main warehouse in Suva. Establishing similar warehouse arrangement for the Western Division is in the radar for the Ministry of Health and Medical Services. Mr. Speaker, while we continue to work to improve the supply of medicine and medical supply for our health facility, it is equally important to understand the access to supplies is also impacted by the global supply chain for this medical product. And we as a nation must be on par in our planning and on mitigating the supply chain challenges as we move on, Mr. Speaker. Collaboration with other partners, Ministry is also working diligently to collaborate and build enduring and fruitful partnership. We have established a donor coordination unit under the ministry, and we are very grateful for our multitude of donors, partners, volunteers, friends, and patriotic organizations and individuals such as DFED, MFED, JICA, Quaker USAID, Rotary, Fiji Red Cross, the embassies, the high commissioners of Australia, New Zealand, China, India, Korea, and Japan, and many non-government organizations, faith-based organizations, the civil society organizations who support the ministry in delivery of health services to the people of Fiji. Mr. Speaker, if I may continue, His Excellency also warned us against danger of misinformation, division, and rhetoric that erode the very fabric of our society. In this age of rapid communication, we must be mindful of the narratives we promote, ensuring that our discussions remain constructive, respectful, and solution-driven instead of engaging in trolling, falsehood, and divisive discourse. We must focus on dialogue that unites us rather than divides us, something that builds us rather than destroys us. As leaders, we must lead by example, fostering an environment where differences are set aside in pursuit for our greater goal. Peace, growth, and prosperity. I will conclude now, Mr. Speaker, if I may. I wish to further express my sincere appreciation to His Excellency for his leadership, wisdom, and dedication, and I wholeheartedly support the motion moved by the Honorable Prime Minister that is before the House this afternoon. I thank you for extra time, Honorable Mr. Speaker.